Good afternoon. I'm Terry Scoggin, CEO of Titus Regional Medical Center in Mount Pleasant, Texas, and today is Wednesday, January 6th. We're going to do something different for the next few weeks. As COVID continues our third surge across Northeast Texas and all of Texas and the South, we are going to do a few things different, and we're going to come to you every couple of days to give updates of where we are. We're getting to the point that we were concerned about in March, April, and May of last year. And a lot of us at the end of the year, including myself, thought at the end of the year that we would just flip the light switch off and COVID would go away. But that's not the case. Over the last few weeks, the third surge that Titus County and Northeast Texas has experienced has continued. And this surge has actually lasted the longest of any of the three surges that we've had. We started right before Thanksgiving, and it's just intensifying over the last few weeks. We've maintained a census of COVID patients between 18 and 20 over the last 14 days, and we're getting to a point where we're maximizing what we can handle in our health system and the surrounding health systems. So I wanted to give you an update today. We'll come back on Friday and Monday and every couple of days. On our off days, we'll put an update on our post on the website for the community knows where we are and knows how important this is to the health of Northeast Texas. As of this afternoon, I just got out of a meeting, we have 21 patients with COVID in our health system. We run a census right now of about 60, so 1/3 of our patients are COVID. 9 of those are ICU COVID patients, the highest number of ICU COVID patients we've had since the start of this pandemic in March of last year. 12 normal COVID patients. But when I say normal, I want to make sure you as the friends and community members that we talk to on a daily basis know that it's not normal. The acuity level of our COVID patients has increased. And many of you know the people that are in our hospital today. They're friends of yours, they're family members of yours. You've talked to them, you've seen them, and you know they're sicker than the people a few months ago, and especially in the summer. So we're seeing that acuity level increase. And you're going to see over the next few days, and the reason why we're on here is we are concerned. And we want to make sure from a community standpoint, the county and Northeast Texas knows the risk that we are now under and want to get your help as we work and fight this crisis together. Over the last few days, we started December 31st, New Year's Eve. As many people were preparing for activities, we had to make the decision to expand our ICU. With the acuity of our patients and number of COVID patients that we've had, we've been able to separate them in the ICU for almost 9 months. We got to a point where it wasn't possible. So we have moved our non-COVID ICU patients to another part of the hospital where they're going to get excellent care. It's a beautiful part of our facility and allows us to take care of 4 non-COVID ICU patients at once and expand our ICU capabilities for COVID patients to 10 patients now in that area on the 3rd floor. So we're excited about that. We're continuing to look for opportunities to expand COVID patients. The ability to transfer a COVID patient is very difficult. It can happen. And I appreciate the assistance we have from our hospitals all around from Dallas, Northeast Texas, Arkansas, Louisiana, Oklahoma, who've assisted us with patients who've needed it, but it is very difficult. So we are preparing to take care of the patients here. If you've been in our ER for the last 2 or 3 weeks, you've seen an increased acuity in the ER. We've had to hold ICU patients in the ER for 1, 2, and even 3 days until beds opened up. You might see patients in the hallway of the ER right now. They'd be non-COVID patients, of course, but our ER has been full for the last few weeks as we hold patients, both non-COVID and COVID, in the ER because we do not have rooms in the hospital to put them. These are the same issues that the hospitals all around us are having. You'll hear the word diversion from other hospitals. Titus Regional Medical Center is open. Our emergency room remains open, and we believe it's our mission to prepare and to be ready for this, but provide health care for Northeast Texas. We're not going to shut our doors. We have to handle it. Now, with that said, the wait time may get a little longer. We may have to have ambulance hold on the bay in the emergency room area, and it's happened in the last few weeks. We've had to hold patients with the ambulance until rooms open up in the ER. So if you need 911, if you need emergency room services, please come. Do not come. Make sure you get that treatment. We are dealing with a pandemic. We're dealing with a crisis, and our friends and our family members are dying, unfortunately. So please use the ER. I ask you to be patient. The nursing staff, the doctors, and everyone involved are doing the best they can to treat patients, to navigate, to coordinate on a daily basis. So we look forward for you helping us in that manner. as we talk about the numbers and we look a little bit at it, you're going to hear some things that are happening across the state of Texas. 187 counties now across the state of Texas are under what we're calling GA31 executive order. As you can see, our trauma area F on January 4th hit 20.21%. So 20% of the available beds, staff beds in Northeast Texas, are filled with COVID patients. The state has restrictions, and if you're above 15% for 7 consecutive days, GA31 goes into impact. It will impact some of the restaurants, businesses in town, but also your hospitals. You do have restrictions on elective procedures, and I do want you to know Titus Regional is working within the guidelines of the governor's executive order. There are some outpatient procedures that we can perform. We have a daily meeting at 1:30. It's the meeting I just got out of, where we review the census. We review all the procedures that are coming, the staffing, the ED, the miscellaneous issues that we have going around in January of every year that you have to deal with flu and other things. But we take that into consideration to make sure we can perform certain outpatient procedures. And if we can do those outpatient procedures without impeding care for COVID patients, it's okay to do them, and we'll continue to do them. But we won't be able to do all outpatient procedures. So you may get that call from a doctor or one of my team members who have to postpone it a week or 2 weeks. We want to make you aware. We're doing everything we can to continue provide health care in this region. We appreciate your support during this time. So vaccines is a huge topic, and it was a few weeks ago, and I was excited, as many of you. And I was glad to see when the FedEx person walked off the elevator with the vaccines, and I saw hope. And over the last few weeks, we need hope. And from what we're starting to see in the increase of acuity, this vaccine is going to be a part of the future of where we're going. We did receive 700 vaccines. We did follow the state's guidelines for phase 1A and 1B to get those vaccines out as quick as possible. We are working closely with the state. I'm sending as many emails and phone calls and letters to different people of different proposals to get more vaccines for not only Mount Pleasant and Titus County, but Northeast Texas that we could help support. So as we get those vaccines and get that information out there, we will try and get those vaccines to the public as quick as possible. We did receive 700 vaccines on the first dose. We did give all those vaccines out as quick as we could. We're ready for our second dose. I was notified on Monday night we did not receive an allocation this week for week 4. Was very disappointed. There is something that's going on in week 5 for rural hospitals, so we're hoping we'll get a large shipment in week 5 and we'll be able to provide for Northeast Texas. I would encourage you, if you would like to get on our vaccine wait list, if you go to our website, titusregional.com, at the top there's a red bar for COVID-19, or just type in titusregional.com/COVID-19. And you click on the COVID-19 vaccine waiting list, the maroon bar that you see in the middle. You click on that and you fill out your form. And that is the form that we'll use as we get more vaccines. And the state allows us to open it up to different groups, phase 1A, 1B, phase 2. We will notify the people on this vaccine and waiting list first to get them shots and coordinate it. Depending on the number of vaccines we receive each week, it will depend on where we have it and where we offer it. I would hope to get where we could do 500 vaccines a day, and we cannot provide that here in the facility and have to go off-site. So we're looking forward to that. But please follow us closely on Facebook. I'll give you an update every other day when we come to do this update as well, where we are on vaccines. You know, I just want to end today and just talk about the symptoms again. If you're dealing with fever, excessive coughing, shortness of breath, guys, this is real. And I encourage you, we have to wear our masks, we have to sanitize, we have to social distance. I know people are tired of quarantining, but it's part of the life that we need to go into. You need to protect your family and your friends. If you're having those symptoms, go to allamericantesting.com. They're having testing across the street on a daily basis, 7 days a week, and get a test. And those results are coming in really quick. My mom consistently goes over there so she can see my father. Family Care Center at 903-577-CARE, 577-CARE. Call and get an appointment. They're open every day, and they can get you tested and see if these symptoms, if they need to get you on some medicines. But I need you to take it serious. We can't tell you who is going to react for what. So COVID is impacting everyone differently. So certain comorbidities, certain things that are happening, you're going to have a higher risk. but it has been crazy to watch over the last few months. Certain people become sicker than others, and it's not an easy thing to target. So we take everyone who comes in with these symptoms seriously, and I would encourage you to nip it in the bud. And if you have these symptoms, you have some concerns, take the precautions that we are talking about. Going to end today with just thank yous. On December 31st, when we decided to expand our ICU and expand COVID rooms, we didn't have a choice. And I truly appreciate all the members of the TRMC team, both clinical and administrative, who worked late into New Year's night, New Year's Day, all the physicians that get on conference call New Year's Eve, New Year's Day, on Saturday and Sunday to get everything worked out. We've also, with the increase in the ICU and the increase in COVID patients, we've had to add physicians. We've had physicians come from Dallas that specialize in intensivists and hospitalists. Dr. Downey, Dr. Akbar, Dr. Thurman, many of our hospitalists are going to pull extra shifts over the next few weeks and work closely to make sure we're taking care of the acuity levels that we have. We're ready for it. We've got the things that we need. The PPE is there. Staffing will always be a concern, so we'll have to continue to watch it. But I just want to say thank you to the doctors for everything they've done during this process. I also want to say thank you to the FCC staff, the Family Care Center down by Herschel's on the south part of town. On New Year's Eve, that Thursday when it was raining so bad, they were outside testing for COVID. They were outside seeing patients and running in and out when it was cold and wet, and on Saturday and then on Sunday and on Friday. I got text message after text message for people who went and saw them and said how happy they were and how friendly they were and how much they cared even though they were outside in the rain. So for the team members out there, and I've reached out and given them emails personally, but just want to give a shout out to all the team members of the Family Care Center in the south part of town for what they are doing on a daily basis. Again, thank you for your support of our health system. Please follow us on Facebook. We'll continue to put updates every day. We'll do this on Mondays, Wednesdays, and Fridays for the next few weeks as we continue to see where we're at with this surge and fight the pandemic and try to mitigate the increasing over the next few weeks. Thank you and God bless.